from the University of Pennsylvania's Abramson Cancer Center. At today's special presentation on COVID and cancer during the AACR annual meeting, we heard data from parts of the world that have been most affected by this disease, including China and Europe. For lung cancer specifically, Dr. Marina Garasino presented data from Teravolt, which is an international registry of patients with thoracic malignancies affected with COVID-19. 200 patients were reported on today, of which 75% had non-small cell lung cancer. Not surprisingly, symptoms of COVID-19 were indistinguishable sometimes from the symptoms of cancer itself. Pneumonia was the most common complicating admitting diagnosis, and about 34.6% mortality was seen in this patient population, with a slightly worse spread outcomes for patients that were older, over the age of 65, and those had COPD or other comorbidities. We also heard data from the French experience by Dr. Barlacy of 137 patients that presented or that had cancer. Higher mortality was seen in patients with worse performance status of 2, 3, or 4 by the ECOG scale, those with heme malignancies, and those had received chemotherapy within 3 months of contracting the virus. Some common themes that were remarkable from these presentations were that cancer patients represent a highly vulnerable population, and we must continue to take every measure to mitigate exposure and minimize risk as much as we can. Thank you for listening.